Hello everyone, this is Dr. Divya and topic for today's discussion is Kwashiorkor. Kwashiorkor, also known as edematous malnutrition because of its association with edema, fluid retention. It is a nutritional disorder most often seen in region experiencing famine. It is a form of malnutrition caused by a lack of protein in the diet. People who have kwashiorkor typically have an extremely emaciated appearance in all body parts except their ankle, feet, and belly, which swell with fluid. Kwashiorkor is rarely found in United States and other countries with a generally steady food supply. Symptoms of kwashiorkor. The symptoms includes growth failure, Parthi irritability, hair changes, anemia, fatty liver, muscle wasting, villus atrophy of small intestine, depigmentation of skin, dermatosis, edema that is hyperalbuminemia. Cause of Kwashiorkor. It is caused by lack of protein in the diet. Every cells in our body contains protein. We need protein in our diet for our body to repair cells and make new cells. A healthy human body regenerates cells in this way constantly. Protein is also especially important for growth during childhood and pregnancy. If the body lacks protein, growth and normal body functions will begin to shut down and kwashiorkor may develop. It is the most common in countries where there is a limited supply or lack of food. It is mostly found in children and infants. This condition is rare in countries where most people have access to enough food and are able to eat adequate amounts of protein. If kwashiorkor does occur, it can be a sign of abuse, neglect, or fad diet, and it's found mostly in children or older adults. Kwashiorkor can also be a sign of an underlying condition such as HIV. Diagnosis of kwashiorkor. It is suspected. The first examine is to check for an enlarged liver and swelling. Next, blood and urine tests may be ordered to measure the level of protein and sugar in blood. Other tests may be performed on blood and urine to measure signs of malnutrition and lack of protein. These tests may look for muscle breakdown, assess kidney function, overall health, and growth. These tests includes arterial blood gas, blood urea nitrogen, blood levels of creatinine, blood levels of potassium, urinalysis, complete blood count. Complication of kwashiorkor. Even with treatment, children who have had kwashiorkor may never reach their full growth and height potential. If treatment comes too late, a child may have permanent physical and mental disabilities. If left untreated, the condition can lead to coma, shock, or even death. Kwashiorkor can be corrected by eating more protein and more calories overall, especially if treatment is started early. First, be given more calories in the form of carbohydrates, sugars, and fats. Once these calories provide energy, then foods with protein will be given. Prevention. First and foremost preventive measure is giving education. Some populations simply aren't informed of basic nutrition, the benefits of breastfeeding or nutritional needs of children and mothers. Second preventive measure is nutritional support. The World Health Organization and other organizations have worked to reintroduce native crops that offer source of protein and micronutrients in affected countries. They have developed nutritional formulas made from locally available resources such as skim milk and peanuts. And disease control is a third measure of preventive. Widespread disease and infectious weaken the immunity of high-risk populations. Diseased bodies require more nutritional resources and could shed calories through chronic diarrhea. Disease also deplete a community's material resource, breeding poverty. Conclusion: left untreated kwashiorkor can be fatal. Death may be caused by infection, dehydration, or liver failure. When treatment begins, people are also at high risk of complication from refeeding syndrome. However, those who are successfully rehabilitated can make a strong recovery. These are all the references. Thank you.